how are you today?
Good.
My name is Elizabeth. What's your name?
My name is Ben Kessinger.
Hi, Ben. What are you doing here today?
I'm here to get my sports physical
Good.
for Neurological.
Oh, that's great. Well, we will do that. Let me go wash my hands and get a few things together, and I'll be right back, okay?
Okay.
Wash. I'm going to come in. I'm going to close the door for privacy, okay? Okay. So tell me a little bit about yourself. How old are you?
I'm 12 years old in Stewart's Creek Middle School.
In middle school? Did you just start middle school?
Yes.
Yeah. So I'm going to ask you a few questions just about your past medical history. And some of the questions might be a little bit strange, but just bear with me for a second, okay? Okay. You told me your name. Do you know where we are right now?
Yes, we're in a doctor's office.
Good. And what season is it outside?
It's summer.
Good. And just about your past, have you had any childhood illnesses that you're aware of, like chicken pox or measles or mumps?
Yes.
What have you had?
Croup.
You had the croup, okay. And are you on any medications?
No, ma'am.
No? Are you allergic to any medications?
No.
No. Are you allergic to anything?
Yes, I'm allergic to cats and dogs.
Oh, what happens when you are around them?
My eyes inflate and I'm very pale. My face is very itchy.
Itchy.
And I have a stuffy nose.
Yes, itchy. What about accidents? Have you had any accidents?
Yes, when I was small, I flipped off a chair and cracked my head open, and I had to get stitches.
You did. Did you lose consciousness that you know of?
No.
Anything else?
Yes, I had to. One time I had a bike wreck and fell in a pile of rocks.
You did.
I had a scar on my forehead.
You cut your head. Were you hospitalized for that?
No, ma'am.
No. Any hospitalizations?
No, ma'am.
Broken bones?
No, ma'am.
No. And what about your parents? Do they have any chronic illnesses that you're aware of?
No, ma'am.
Okay. Do you smoke or drink alcohol?
No, ma'am.
Any drugs?
No.
No. Okay. So Ben seems to be a super healthy, very alert young man. He appears to be his stated age. His clothes are appropriate for the weather. They're clean and well maintained. His mood and affect are appropriate. His speech is articulate. And he conveys messages clearly. Let me see your hands, Ben. His hands are clean and well maintained. Nails are well maintained. Cap refill is less than 3. Why don't you get off that table for me for 1 second? So he rises easily from a seated position. Now I want you to just walk over there and walk back very slowly. Gait is smooth and effortless. No involuntary movements, no mobility devices. Range of motion is appropriate. And while I've got you up, why don't we go ahead and weigh you and measure you, okay? Ben weighs 47 kilograms. Let's measure you real quick. Hold this at your forehead. And he is 54 inches tall. That's fine. Pop back up on the table and we'll get the rest of your vital signs real quick. There we go. Put that under your tongue and hold it there. I'm just going to take your pulse. So Ben's pulse is 56, his respirations are 15, and his temp is 98.7. Perfect. So now I'm just going to start with your head and kind of look you over a little bit, okay? Okay. So Ben's hair is clean, well maintained, evenly distributed, no patches missing anywhere. Scalp is clean, no dry spots, no lesions. Okay, good. Do you have any soreness anywhere?
No, ma'am.
No lumps are felt anywhere?
No, ma'am.
Well, I don't feel any either. And now I'm just going to feel your sinuses, okay? Is your frontal sinuses any tenderness?
No, ma'am.
No? Maxillary, any tenderness?
No, ma'am.
No? Okay. And now we're just going to do some stuff with your eyes, okay? So I want you to take this and cover your eye with it. I'm going to do the same thing. And then I want you to tell me when you can see my finger, okay?
Yes. Yes.
Okay, let's switch.
Yes.
Good.
Yes.
Good. Peripheral vision is intact. And now we're just going to check your extraocular movements with the 6 cardinal fields of vision. Head still and just watch me with your eyes, okay? Just follow my finger. Movement is smooth, parallel, with no nystagmus. Good. And now I'm just going to look in your eye, kind of to the side of your eye with this light, okay? It's called a corneal light reflex. Good. Light is reflected evenly in both eyes. And now I'm going to put the light in your eye, okay? The pupils are 4 equal round and reactive to light. I know that's hard, isn't it? Watch my finger. An accommodation. Good. Now I'm going to look in your eyes. Conjunctiva is clear and moist. Sclera is white, moist, no edema. Corneas are clear, no opacities appreciated. Irides are flat, equal bilaterally, round, no discoloration. Eyebrows are symmetric. Eyelids overlap the irises just slightly. You okay? Did the light bother you?
Yeah.
Okay. So now I'm just going to feel and look at your ears, okay? Okay. So I'm just going to look first. There's no drainage, no lesions. Okay. Are they sensitive?
No, ma'am.
Any pain anywhere?
No, ma'am.
Open your mouth. Ah. Okay, close. Smooth. Good. Now I'm going to go behind you and just whisper something, and I want to see if you can hear me, okay?
Okay.
Okay. Tell me which side and what you hear.
555 right ear. Boys, 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 left ear.
Good. So Ben's hearing seems to be intact. He gives great eye contact, which is another indicator that his hearing is intact. His nose is symmetric and is proportional to his face. He has a small pimple there, but otherwise no lesions. Any sensitivity here?
Okay.
No? A little bit of clear drainage. Are you just getting over a cold?
Yes, ma'am.
Yeah. Facial features are symmetric. Can you lift your eyebrows for me? Just lift your eyebrows. Good. Smile for me. Okay. Now I'm going to look inside your mouth. Okay. You're going to feel my finger just a little bit, but I want you to open wide and tilt your head back. Good. Buccal mucosa is moist and pink. Open. No lesions present. Open wide for me. Gums are pink and moist. No lesions. Firm with distinct edges. Open. Open. Put your tongue in. No dental caries. First molars present. Open again. Lift your tongue up. The floor of the mouth is firm and moist. No induration, no ulcerations. Ventral surface of the tongue is smooth and moist. Let me see the top of your tongue. Yeah. Dorsal surface is rough, a little bit white but moist. Open. Rugae present on the hard palate. Soft palate is smooth and moist, a little bit white. Stick your tongue out. Tongue is midline. Say ah.
Ah.
Uvula and soft palate, upwardly mobile. Tonsils present. +1, just visible. Good. Perfect. So now I'm going to look at your neck for a second, okay? Just move. No visible pulsations, no lumps that are visible. Can you just move your neck around? No limitation to range of motion. Do you have any kind of soreness or anything like that?
No, ma'am.
I'm just going to palpate your lymph nodes now, okay? Tell me if anything is tender at all. Any tenderness? No? Lymph nodes are all soft and mobile. Carotid pulses, palpable and equal bilaterally. Trachea is midline and mobile. Good. Head sits midline on the body. The muscles of the neck are symmetric and defined appropriately for age. Let's take your shirt off real quick so I can see everything else. Lift your shoulders for me. Good. Trapezius and accessory muscles of the shoulders are symmetric and defined appropriately for age. The skin on the chest is even in coloration, no lesions present, no abnormal moles. I'm just going to palpate. See if you have any tenderness. Do you have any tenderness anywhere? No lumps palpable? I'm going to go to your back. I want you to turn your back just a little bit. Good. Now I'm going to squeeze right here. Let all your air out. All the air out. Good. Take a big deep breath in. Even expansion of the chest. Now you're going to feel me kind of thumping on your back a little bit, okay?
Okay.
Okay. It's a good one. No dullness, only resonance throughout. Now I'm going to listen to your lung sounds, Ben, okay? Keep your hips turned for me, honey. Okay. Breathe. Breathe. Very good. Lung sounds are clear. No adventitious lung sounds at all. Okay. Can you lay down for me? So just on visualization, there are no pulsations visible on the chest, the precordium. And I'm going to, the skin is even, and I'm going to just palpate your pulse, okay, at your chest, Ben, okay? Can you take a big deep breath in and then let it out and hold? All the way out. Good. Now hold. Apical impulse is present at fifth intercostal space, midclavicular line. Good. Now I'm going to listen to your heart sounds, okay, Ben? S1 and S2, audible. No murmurs. No extra heart sounds. Rate of 56, regular rhythm. No click or low audible. So now I'm just going to look at your abdomen then. There are no visible pulsations. The umbilicus is midline. There's no discoloration or swelling. No hernia present. And I'm going to mix it up. I'm going to listen first and then I'm going to touch, okay?
Okay.
Your bowel sounds in all 4 quadrants. Not audible word. And now I'm just going to feel. Put your hands to your sides. There we go. Now just gently at first, okay? I'm not able to palpate the liver. Kidneys. Cannot palpate the spleen either. Now just deep. Remember what we did? Take a big deep breath. Let it out. Relax your abdomen. Relax. Good. Nothing palpable. Do it again. Take a big breath. Let it out. Relax. Nothing palpable. Nothing palpable. Okay. It's all done. Your hips. Now I'm going to look at the lower extremities. Just on inspection, you have some bumps down here, Ben. What happened? Do you have some bug bites?
I got those in the woods.
Do they itch?
Yes.
They do?
A lot.
So he doesn't have any edema on his legs. His feet are a little bit cooler than his legs, but even bilaterally. Dorsalis pedis is palpable and even bilaterally. Posterior tib is palpable and even bilaterally. Cap refill is less than 3 in his cold feet. Okay, sit up for me then. Good. So now we're just going to do some funny tests to test your brain, okay? First I want you to touch your nose and touch my finger, okay? Good. Now I want you to close your eyes and lift your arms and touch your nose. Very good. No difficulties at all. Open your eyes. Now I want you to slap, 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 and do it rapidly.
Oh.
Good. No difficulties. Now I want you to take your heel and run it down your opposite shin for me, okay? And do it on the other side. Very good. No difficulties at all. Very smooth movement. And now we're just going to test your sensation, okay? You can keep your eyes open. Just tell me if it feels the same.
Same. Same. Same. Same. Same. Same. Same. Same.
And now I'm going to test, and we're going to test sharp and soft, okay? So
Okay.
close your eyes on this one.
Soft. Sharp. Sharp. Soft. Sharp. 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 Soft.
So the exam is over now, Ben. And now we just want to talk about a couple of things that maybe you could do to lead a healthier lifestyle. You're a super healthy boy, but maybe there are some things you could do to be a little healthier, okay?
Okay.
I want you to try to increase your vegetable and fruit intake to 6 to 8 servings a day. That's a good number, okay?
Okay.
And maybe decrease fast food to maybe once a month. Does that sound good?
Yes, ma'am.
And then on the days that you're in school, especially when you sit a lot, I want you to limit your television time or video game time to about an hour to an hour and a half a day. Okay? Does that sound good?
Yes, ma'am.
Okay. It was great to meet you, Ben. It's still not stopping.